Yeah, so thanks for the introduction. Yeah, my name is Dan Arndorfer. I'm a third year, I guess, starting fourth year medical student at UW-Madison. And I'm in the Triumph project, which involves coming here to Milwaukee for all our clinical rotations. And I work with the Urban Ecology Center, and then we also partner with Milwaukee River Keepers and UWM on this project called CLEAR, which stands for Community Leaders Engaged in Aquatic Research. And this project is focused on identifying some of the emerging contaminants in Milwaukee's waterways. And it's a very community-based project involving both the sampling and data distribution and that sorts of stuff. So just for an overview of my talk today, we're going to kind of go over what is an emerging contaminant. We're going to go over kind of what our understanding is about some of these substances. I've picked like 2 or 3 to highlight, just so we can get an idea of why these things are important. Then we're going to talk about the results of our project, some of the things we're finding, and then lastly talk about what can be done, what can we intervene on to impact the quality of our waterways. So without further ado, yeah, emerging contaminants. So this is defined as chemicals that are not currently or have only been recently regulated by the environmental regulatory bodies and are concerns regarding the impact on human or ecological health. So these are things, they could be anything from pharmaceuticals to pesticides, consumer products that are kind of thought to fall through the cracks of both wastewater treatment and testing. And there's concern that these things may be impacting human health or environmental health in one way or another. And before I kind of get into the depths of the presentation, like Ethan said, if anyone has any questions, you can put them in the chat and Ethan can answer them, or you can unmute yourself and ask, because it's not a super long presentation, so I was hoping to make it interactive and fun. So if anyone has any questions, that'd be great. So this is kind of an overview of the sources we typically think about when it comes to waterway pollution. Things like pesticides on the crops, or factories polluting the water, leaking pipes and sewers, or you see, I'm at St. Luke's right now in the Kinnickinnic River. I drove over today and you see all garbage and refuse in it, unfortunately. So these are kind of the sources we think about with pollution. But one kind of growing area of concern are things that slip through our current wastewater treatment facilities. So this is just kind of a brief overview of how sewage treatment works. So you can see that we actually have a pretty good methodical way of removing most things from sewage, both by filtration, aeration. So on the surface, this looks like a really good way to remove the things that are coming through the sewer. But when we look a little closer, we see that a lot of the recent data is showing that for a lot of medications and chemicals, that half of them or less by concentration are removed by sewage treatment. So that means that the other half is getting pumped right directly back into our lakes and rivers, which is a growing area of concern. So I'm just going to highlight 2 or 3 of kind of these interesting chemicals that are slipping through the cracks and what we are starting to learn about them. So here we have, this was a recent study done by, I think it was like the Great Lakes Commission. And you see here, this is just a list of all the chemicals they tested for, lots of long names. But so in this leftmost column are things that are removed pretty poorly by wastewater treatment facilities. And in this middle column are things that are so-so with removal. And then things on the right are things that we remove pretty well. And I've just highlighted in red here, these are the chemicals that we, with our data, have detected at pretty significant amounts. So you can almost kind of see that there's more things in that left column and middle column that may be slipping through the wastewater treatment facilities. So I'm going to talk about carbamazepine, antibiotics next. So carbamazepine, which is one of the things that was just listed on that list for the pore removal ability, It's a really common medication we use in the clinic. It's actually used both to treat seizures and bipolar disorder. It's first-line treatment for many patients with either of those conditions. And it works by kind of quieting down or slowing the nerves. The problem is, when this medication, if people, throw the unused medication in the toilet or it gets polluted, there's actually been some data showing that it slows the reaction time of fishes. So that nerve slowing effect doesn't just work in people, but it also works in all the, marine animals in the water too. And then I'm trying to tie some of these things back into human health as well. So this is just a recent study that was done. With carbamazepine not being well removed, there was the question of, well, what's this residual amount in the environment doing to us? So this was a study that they did, and they actually found, which is pretty scary, that even the little amounts that are found in the environment can cross the placenta and enter the brain of the fetus. And kind of the reason they did this study is carbamazepine is totally contraindicated for pregnant women in medicine. You never ever give it to pregnant women. So it's kind of the question now of, we know there's some trickling out into the environment. How is that impacting, fetuses, pregnant mothers? And the short answer, we don't know, but it certainly doesn't look good. And so then the second chemical I chose to highlight is triclosan. This is just a super ubiquitous chemical they dump it in everything. And they use it because it prevents the growth of bacteria and fungi. So this is added to so many consumer products to extend the shelf life of them. And the CDC just did a study where they looked at the urine of tons of people in the US for chemicals that are building up in our bodies. And pretty scary as well. They found that there was triclosan in 3 out of 4 people that they sampled with the urine. And in clinical studies, higher levels in the human body have been shown to impact a lot of the different hormones like thyroid hormone, estrogen. So this is just, I pulled a couple labels that I found. So on the top left is toothpaste. You get your fluoride treatment, they threw triclosan in there. The top right is hand soap, it's got triclosan. On the bottom is deodorant, they threw triclosan in. So again, super ubiquitous chemical that ends up, going down soap directly down the drain, not well removed, and then ends up in our lakes and rivers. Next chemical is atrazine. This is a really super common herbicide that they spray on crops every year, Wisconsin included. We know that it can be toxic to fish and it can cause cancer in humans in high amounts. It's actually banned in Europe because of the cancer link, still used here. And again, this is something we detect. You're going to see a lot in our data. Yeah, not so happy for the fish. And again, another study showing that kind of effects on pregnancy, that atrazine exposure in the drinking water can be associated with preterm birth. And then the last kind of thing I wanted to highlight is just the catch-all of antibiotics, which I think, a lot of people are starting to become aware of what a problem this can be. So, in addition to being prescribed for people, lots of people don't realize that farmers add antibiotics to feed for cows, pigs, chickens, because it actually makes the animals grow a little bit faster. The problem is, you're dumping all these antibiotics into the environment, and they end up again in our lakes and rivers. We also add them to soaps and disinfectants a lot of times unnecessarily. I mean, I think there's been recent legislation kind of banning it, but if you ever see soap with antibiotics or antibacterial, you don't buy it, because soap itself is antibacterial, so there's no need to add antibiotics to soap. And there's a lot of data on antibiotics being bad for the environment. And then another kind of growing area of concern is antibiotic resistance. So this is when bacteria get exposed to the antibiotics, and they're clever, so they find ways to get around it. So we see a lot of patients in the hospital now with infections that they don't even respond to the antibiotics anymore. So these are just a couple other papers I threw in. The top one showing that, these environmental concentrations that are seeping into lakes and rivers are impacting fish. And then the bottom one is again kind of highlighting that even that environmental concentration that's seeping out is causing more resistance of bacteria to these antibiotics, which is really, really scary for healthcare. Okay, so that was kind of a quick overview of some of the chemicals that I found some interesting stuff about. But now I kind of want to touch about our project and the things we're finding. So just kind of an overview of the CLEAR project. I'm sure some of the people listening are familiar with it or have even participated with it. But what this project seeks to do is identify the concentration of some of these emerging contaminants in the Milwaukee rivers. So we have community volunteers actually do most of the data collecting. So at the Urban Ecology Center, we have kits that can be picked up. And then any community member can go to one of the sampling locations, get a water sample, bring it back, drop it off at UEC. And then that sample is analyzed. That's Dr. Todd Miller pictured at the bottom. Analyzed over at UWM for the concentration of these different chemicals. And then we have a website and social media to kind of post what we're finding about some of these different chemicals. So this is the website I was talking about. Highly recommend giving it a perusal after the presentation. It's ClearMke.com. And shout out to Katie over at Milwaukee River Keepers and some of the other people too for working really hard. We just got this website back up and going. But I think it's a real nice, user-friendly website to click through. And you can look at our results, the chemicals we're finding. You can sign up to be a volunteer if you want to participate in some of the sampling events. And then there's lots and lots of background information about the chemicals and the impact they have. So this is our data for 2016, 2017. With how frequently we detected some of these compounds in the Milwaukee waterways. So you can see here on the right, actually the most frequently detected compound was caffeine, which is actually, if you remember way back to the chart, it's pretty well removed by wastewater treatment. So this might be from pollution, people's Starbucks cups, stuff like that. And then number two, actually right after caffeine, kind of surprisingly, is that carbamazepine, which is the anti-seizure medication that I was talking about had the effects in pregnancy. So kind of surprising that that's the number two thing in our waterways after caffeine. And then the sulfamethazole, the trimethoprim, Triclosan, there's lots of antibiotics listed here that we detected pretty frequently in the water, which is worrying. And then the Atrazine is number 4, which is the herbicide I was talking about that's banned in Europe, but still used pretty extensively here. So you can see that, for lots of these chemicals, they're detected pretty frequently, for some of them even in over half of our samples. So again, shout out to the website. If you want to go on the website and click on the Our Data tab, there's a lot of interactive ways to kind of view the data. At the top here, you can pick any individual chemical. So I just picked carbamazepine here, the anti-seizure med, and then you can look at the concentration across all of our different sampling locations. So like here, River Edge Nature Center was the highest carbamazepine across all of our sampling sites, followed by the Third Ward, which is interesting. And then there's also a map feature you can see here on the bottom, which again is carbamazepine here. So you can kind of see a heat map of where some of these chemicals are, and kind of clustered on the downtown area you can see here for carbamazepine. And that may be a function of some of the different sewer outlets or street outlets as the river flows into downtown. So kind of the last thing I wanted to talk about is, so we're finding all these things, what can we kind of do about it to make a difference? So probably the most important thing for all the medications, the antibiotics, is to make sure that they're not ending up flushed down the toilet or put in the sink. So there's a website called Take Back My Meds, which it's super nice. You can go in, type in your address, and find drop boxes. And it kind of on the map here, you can see, is it a fire station, a library, a police station? So whatever you're comfortable with, you can go to one of these municipal locations and dump your unused medications in like a box there, so that it doesn't end up, either sitting in your cabinet and expiring, or in the trash, or, flush down the toilet or sink eventually. So this is, one really important way to make sure some of these things aren't in the environment. Another really important way is to, try to the best of our ability to not buy products with all of these added chemicals. So kind of looking for more natural soaps, dish detergent, hand washing liquid, looking for more natural products, and then avoiding things specifically like, don't buy any soaps with added antibiotics, or if they say, antimicrobial soap, it's totally unnecessary. Looking for things without triclosan. So again, it can be difficult because they're in a lot of things, but I was just out of curiosity perusing at Walmart, and like the deodorants and toothpaste, it's listed right on the back if it, contains triclosan. So that's another way to kind of just avoid buying them, so these things don't end up in our lakes and waterways. And then kind of, the catch-all also of, pollution, trash cleanup, all those things too are going to be important for making sure these chemicals don't end up in the waterway. And, we're hoping with our data and that what we've been finding and putting out there, that, and there's a lot of other groups kind of working on this in different cities and areas. We're hoping that, some of these things that we're finding, like carbamazepine, that are becoming increasingly concerning, that, maybe they will get tested for in wastewater treatment in the next couple of years, or, maybe they will add some better purification strategies if the community is saying that these things are important. So this is my plethora of sources for all the figures and studies cited. So I saved some time at the end. I know this was kind of heavy with some of the chemicals and data, but I just wanted to leave time for if there's anyone with questions or concerns, or even just thoughts you had about either, any of it, the data, the research on the chemicals, or your thoughts on it.
Hey Dan, it looks like we have a couple of questions coming in through the chat. We have, what percent of the contamination is from excretion, and what percent is dumping or going into runoff, I think is what the question's getting at.
Yeah. So that's a great question. And for a lot of the chemicals, the short answer is it's really hard to answer. And, what really muddies the picture is some of these chemicals, like especially opioids, there is one form that if you're going to take a pill is in the pill, but then once you take it via usually the liver, it's converted to other metabolites or compounds when it's broken down. And then so those are excreted in waste and end up in wastewater treatment. And so for any one original, medication, you may end up with 3, 4, 10 different metabolites or breakdown products that occur naturally. And some of those are actually active as well and have impacts. I know some of, like, for opioids, for example, we take in one form of the opioid, it gets digested and then excreted through our urine. But even what's getting excreted, we've found, has an impact on fish. So the short answer is it's really it's difficult to tell, like, what's coming directly from people, dumping the pill bottles and what's coming through just naturally excreted after taking it correctly. But that, that's one of the things that they're starting to look for, is how can we quantify that and figure out what some of these metabolites are.
Great. We have another question. You kind of touched on it briefly, but do these chemicals build up in the fish we eat?
Yeah, and for a lot of them, they do. There is you can look up. There's, like, it's called a bioaccumulation. So over the course of its lifetime, if a fish is just exposed to even a low level of some of these chemicals, the concentration increases, whether it's in the bones or the meat or the fat. And then it can even kind of accumulate up the food chain, right? So if there's little minnows that are exposed to the chemical, they're accumulating it. Then when a bigger fish eats the minnows, it's getting a big dose of the medication. And then when a hawk comes and eats the larger fish, then the hawk's, getting exposed to massive concentration. So that's kind of what we saw with DDT, was it was really getting concentrated up the food chain. And that's the chemical that is banned now, but was causing the plummet in bald eagle populations in, like, the, I think, 60s and 70s, is that was really accumulating up the food chain. So I know with, like, carbamazepine, for sure, there's data that accumulates over time. So yeah, it definitely is another worrying consideration, and a lot of these do accumulate.
Great, thanks. We have someone else who thinks that there should be extended major public relation messages sent out so that the general public is aware of these issues and can actually find places, like you talked about, where to dispose of drugs. The question then, is there any budget within the CLEAR program or other organizations to fund such messaging?
Yeah, and maybe Tim would be great to hop in on this too with thoughts. But I know with CLEAR, part of our grant funding is the, the outreach with kind of, at least with our data that we've been finding. So it's definitely been made difficult with COVID, because in the past, we've wanted to do, like, community tabling events. But, we've got this website up and running. We piggyback with Milwaukee River Keepers social media site. They've been posting some of the findings. And then one of the areas where I've personally been involved is we're really trying to get this out to some of the schools in the area. So we've already had, I don't know, at least half a dozen or more classrooms go through, like, a similar lecture to this for the students about chemicals in the waterway and what can be done. But you're absolutely right. I think there's organizations like Take Back My Meds that they focus exclusively on funding the, the drop box and the medication return. I really wish there was more outreach happening here. I'm at, the hospital right now, because that's certainly not something that's talked about when patients are prescribed or given meds. I feel like there should be advertisements here at the hospital, like, if you don't use your meds, if you don't need your meds, do not throw them, don't flush them, go to this website. Or, even if prescribers, it would just be one sentence, and I don't see that happening, physicians or whoever prescribing to say, oh, if you don't finish it, make sure you take it to a drop box and don't, throw it out. So I feel like that would be another area to intervene that's currently not really a lot being done.
Yeah, I guess I would just add that the organization Clear is very loose. And so you have a few organizations working together, but there is no kind of central funding source. We have to rely on grants, and when the grants come in, doing certain things. Dan has been a really, really great kind of centerpiece of coordinating the parts that are here, and providing a lot of the research and that kind of thing. But there's, like he said, we're looking at school outreach right now. There's still the opportunities for volunteers. I think if one of the brainchilds behind this, the dean of the UWM Freshwater Sciences, would like to see something like this that is Great Lakes wide eventually, something where we can track these patterns and look for, sometimes what this will tell us is that you have leaky pipes somewhere, and so it's bypassing the system entirely. So it could be that small, but really it's finding the greater sources of from kind of an advocacy or a policy perspective. It'd be great to coordinate this Great Lakes wide. So right now we're running on a shoestring budget. We've seen some growth, particularly in education, but I think our biggest problem right now is we don't have kind of one centralized organization spot to keep this moving. But yeah, it's we've seen a lot of really great work over the last 4 or 5 years. I'll just read this next question. This is what about the lead? So there's a question. I know a lot of us have filters to filter out lead. Mm-hmm. And does that filter out the other contaminants? And that's a good question too, because you think of the water that's coming into your pipes as clean, right? Because it's purified. Mm-hmm. But I would imagine that some of these contaminants kind of could maybe bypass that system and get into your drinking water.
Yeah. So one of the things not pictured on that graph of the sewage treatment is it kind of had an arrow. So what I portrayed in that photo was that's what's done to water that we're just going to pump out into the lakes and rivers. If it's going to go to drinking water, it actually goes through a whole nother round of purification that's a lot more specific and targeted and better. That's not to say that things still don't get through, the cracks. I think there was one paper, and while it was much lower than what was in the rivers and streams, there actually was detectable carbamazepine, the anti-seizure med, in drinking water in a lot of places. So yeah, I feel like there is another layer of protection that I didn't talk about, but it's not perfect. And yeah, I wish I knew, but I'm really not sure as to let's just say a Brita filter, what percent that would remove of some of these chemicals. That data might be out there, but I'm not aware of that.
I would imagine that there's nothing in your Brita filters that isn't in the main treatment. Yeah, so it's really the lead pipes that you're really the only thing that would
It looks like Larry and Gailey have a question.
Two, if you don't mind.
Oh yeah, sure, yep.
And I'll preface it as the fact that I'm a retired internist. So
okay.
So the first one is carbamazepine is not rare, but it's not that widely prescribed.
Yeah,
a lot of other things. So what is it about carbamazepine that it sort of sticks around and winds up to that extent in the water supply?
Yeah, that's a great question, because I have the exact same reaction, because you look at some of the other things around the chart, like antibiotics that are just like candy, and versus carbamazepine. But from the data I've been seeing, it really doesn't break down in the environment to the degree that a lot of the other chemicals do. It can accumulate pretty rapidly. And then also that, you know, on that graph, we remove it pretty poorly as well. So, you know, I feel like there might still be another element that we're missing because it does seem very high. But I think it's kind of maybe that trifecta of, you know, not being well removed, not degrading well in the environment, and accumulating in, you know, in the environment and organisms as well.
And the second question has to do with opiates winding up in the water supply. And what's a little strange there is the FDA has considered it safe to flush opiates down the toilet.
Yeah.
And whenever I have seen that in the past, I've thought, we're bringing all these other drugs to the drop boxes. Why are they telling us that it's okay to do that?
Yeah. Yeah. I actually wasn't even aware of that notification, but yeah, it seems like it would be not a great one. I don't know, because yeah, I was reading some papers, and they certainly, not even just the opioids, but the metabolites they've found can impact fish. I'm wondering if that's maybe a public health intervention where they're preferencing just getting it out of people's hands, whereas, you know, if you say I'm going to take it to the drop box, you know, there's more room for it getting left somewhere, or stolen or misplaced or forgotten about. I'm not sure, but it does seem kind of weird to just say, you know, flush them right away.
Right. It's always seemed odd to me.
Yeah. Yeah, maybe that is the case, that they're just saying, you know, flush them so they're out of people's hands.
I've got another question about, you know, so there's places that you can drop medicines off. Is there anybody that would pick up medicines from people that are maybe less mobile, the elderly? I don't know, maybe nursing homes, things like that. Are you aware of anything like that?
That's a great question. I haven't heard about anything like that in Milwaukee. I know we have like home nurses here, so that might be an area of opportunity. But yeah, I'm not currently aware of anything like that being offered. I know some like if you're in a nursing facility, a lot of times they'll have a partnership, you know. But for people that are living independently and not as mobile, yeah, I'm not aware of anything.